Welcome to our immunity event. Thank you so much for taking time out of your life to come hang out with us a little bit on a Tuesday night. Some of you, this may be your first chance that you have to leave home and you're still sticking it out with us. And some of you are still under stay-at-home orders. So thank you so much for getting a little entertainment here tonight. We hope it will be super profitable because you are going to get to hear from some incredible people tonight about immune system. Gut health and immune health are so strongly connected. In fact, over 70% of our immune health depends on our gut. And oftentimes the mystery symptoms that we feel are really just tied to our guts and immune health. For example, disrupted immune function can cause things like internal inflammation. Even allergies can just be a sign that your immune system is overreacting to a false alarm. Every single day, our immune system encounters billions of things like bacteria, viruses, toxins, parasites, pathogens. So having an optimized immune system is really vital to our health. Tonight, you're going to get to hear from 4 people with their unique perspectives and chat immunity. First, you're going to get to hear from Brooke. She is an advanced practice nurse with a master in the science of nursing. And these products have helped her with mood, less anxiousness, even though she's right in the middle of a home remodel, energy, and given her patience with her kids. During all of this, she's also enjoyed hanging out with her kids and doing that home reno during quarantine. So tell us a little bit tonight about some lifestyle tips as how we can boost our immune system, Brooke.
My top 2 tips that I would recommend anybody do, and they cost you nothing, is number 1, drink your water. As a family nurse practitioner, I can't remember how many times I would look at labs in the ER, and we are almost all chronically dehydrated. I don't know how much you think you might drink. It's probably not enough. And when your body doesn't get enough water, it's going to hang on to what it has because it's going to say, I don't know when Brooke's going to give me another drink. So I'm going to go ahead and hang on to that. And that can cause some unwanted bloating and all sorts of things. Water is just good for every single system in your body. And so that would be tip number 1, essentially costs next to nothing. Get your water in. Tip number 2, control your mind, y'all, especially in this time, right? We can choose what to focus on. There's so much good around us. Turn down the radio, like off the news channels, shut off the news, focus on the good that you see around you and be in that healthy state. That will do so much for your immune system and keep that cortisol level low, because that is what happens when you're stressed out from hearing things that you're, kind of that input. So yeah, mindset, water.
I love it. Drink our water and turn off the news. Great advice. So I feel like in my research, it seems like doctors and nurses and medical professionals get a lot more training in drug prescription than nutrition. So they typically go after what they've been taught. What do you find boosts immune system better? Prescriptions, supplements, or what?
Oh, girl, that's not even a question. But what I can tell you is before I was introduced to Plexus and gut health, I thought that everything had to be FDA approved or had to be a prescription. And what I've learned, I had to put my pride and ego aside and do a little bit of research and learn about the microbiome, was that what I already knew. Drugs are chemicals with therapeutic side effects. So we can put you on a drug for your anxiety or for your blood pressure. And that is a side effect, that it lowers your blood pressure or it lowers your anxiety. It also has 979, okay, I exaggerated a little bit, but other side effects because it's a chemical. It is a chemical with therapeutic side effects. And so while some of those are good and we need them, if you do not have to put one in your body, don't do it because it's going to destroy your microbiome. It was never intended to be processed by our system. It doesn't know what to do with it. And so by far, if you can treat things naturally and boost your immune system, taking care of that microbiome, and I'm sure you're going to hear that word a lot tonight, is going to do so much for your immune system. That is the best thing that you can do.
I love it. And I feel like that 979, that might not actually be an exaggeration. We've all seen those commercials. Take this prescription and you may experience XYZ. So I love that. So if we don't want all of those chemicals and side effects and we can avoid it, what would your top recommendation be for us to get started with some of these supplements for our immune system?
Hands down, the triplex, which is our best-selling combo for overall gut health. That's going to be our Slim, our ProBio 5, and our BioCleanse. And that's because I believe it goes in and hits the root cause of these problems. It enhances the good bacteria. gets rid of some of the bad bacteria, kind of helps you find that healthy balance where in the army, the good guys are winning and they're outnumbering the bad. And that's when you see that immune system soar. You see that immune system boosted, and you're going in and kind of detoxifying, like breaking down the bad, eliminating it from your system, all the goodness that comes from the triplex. That is where I would start for overall immune health. And, it wouldn't hurt to throw in some vital biomes, some extra probiotics. Once you get that detoxification going and kind of weed that garden a little bit, then toss in some good seeds for extra measure.
I love that. Thank you so much. Have fun on your renovation.
I will. Thank you.
Awesome. Next, we're going to get to hear from Lisa. She's a 20-year experienced nurse. These products have helped her with things like chronic sinus infections, IBS, and better sleep. Her favorite thing that she's done during all of this stay-at-home stuff is play games and swim in the pool with her family, and she loves taking time to read. So, Lisa, can you tell us a little bit about what good supplementation does for our immune system? How does it boost it?
Yeah, of course. So first of all, I feel like it's multifaceted. We are too stressed out nowadays. We don't get enough sleep. We put too much on our plate, not enough. So we don't get the exercise that we need, which we know will boost your immune system if you exercise, but we don't feel like exercising because we're too tired, because we have poor gut health and we have our blood sugar balance is not happening. We have too much inflammation. We don't get enough water intake, like Brooke was talking about earlier. But I think that the majority reason for that is because that we live in a want it now society. We want what we want now. We don't want to take the time to cook healthy meals. We want to go through the drive-through. And even though there are healthier options in the drive-through, we have not prepped our system to even crave those things. So we crave the bad things. So it's so important that to be able to use these supplements in our ability to be able to boost immune system. It's filling in that nutritional gap. A lot of people say, well, you just eat right. And I hear that, but we've done decades of damage. I don't know about y'all's parents, but back in the 80s when I was growing up, we didn't know that you're not supposed to have, really sweet tea and at every meal and dessert and everything. So we've kind of have a lot of damage that we need to undo. And so this is really helping to bridge that nutritional gap for us.
I love that. Thank you. So in being a nurse for 20 years, how has Plexus supplements kind of incorporated into your nursing practice?
Okay, so I really love that because, 20 plus years ago when I was in nursing school, they didn't teach us about preventative medicine. They always said, an apple a day keeps the doctor away, but they never really talked about getting to the root issue. So they talked about pharmaceuticals. We had a whole, section of class on that. They talked about getting a diagnosis. And once you have a diagnosis, you give them a prescription. And unfortunately, the way that healthcare, not all healthcare, but a lot of Western medicine healthcare is done nowadays, is you identify the issue, you give them a diagnosis, you give them a prescription, you send them on their way so you can see the next patient. And we're kind of like herding cattle. Again, not all doctors, not all practices, but a lot, just so we can see the next person. Because if you were to tell a patient, okay, I'm not going to give you a prescription because the root of the issue is you have poor gut health. So, let's follow this criteria and then get back with me in 3 to 6 months. There's no way they're going to go to another doctor because we want it now. We want results now. And a lot of times we don't care about the consequences, just like you were talking about the side effects of the prescription, which sometimes are even worse than the reason we took the prescription in the first place. We just want it now. We want results right now. So unfortunately, that's what's going on a lot. We don't have that time to educate our patients, to start that conversation is what I love, to be able to tell patients, especially when they're at their wits' end of being on these prescriptions for so long, hey, let's look at getting to the root issue of your problem. So it starts that conversation. So that's how I really love now that I'm able to incorporate that when I talk to my patients.
I love it. You talk about getting to the root instead of just treating the symptom. So, and if we don't want to treat the symptom and we want to get to the root, what would you say in all of your experience as a nurse would be the best supplements that we could get started on to do that?
So that's a hard question to answer because I don't feel like there's just one. But if I just Had to pick just one, 100%, I would pick the Probio 5 because all disease does start in the gut. I'm convinced now, nursing school, maybe not, but I'm convinced that everything, all of our chronic health issues especially start in the gut. So if you could only pick one product, I would definitely say the Probio 5 because with the combination of the probiotics that they have chosen, and with the antifungal, which is huge, you don't see that anywhere. And the digestive enzymes, it really helps to attack on 3 different ways, especially the gut health issues that so many of us are really just blind to. I guess I would say just uneducated to. And so if we can kind of start there, that's really going to get someone kind of like a diving board, like a springboard to be able to address a lot of their health issues if we can start in the gut.
So in your experience, as far as helping people, if I would say I want to stay out of the hospital, what would you recommend I should start on today in addition to that Probio 5?
Well, all of them. I guess what Brooke would say, I love that triplex. I love that we can balance our blood sugars, address gut health, and the magnesium in that BioCleanse is I didn't know how many body functions depend on having a good level of magnesium. So many of us are deficient in magnesium, and there are hundreds of body processes that depend on it. And so I love that. But also on top of that, I really think that our X Factor multivitamin and X Factor Plus, hands down, are the best vitamins that I've ever seen. And so especially with that aloe, you don't see that anywhere else inside your vitamins, which are already bioavailable. So we're actually able to absorb what we're taking and we're not just, flushing it out. So
I love that. Thank you so much for sharing that. Magnesium she was talking about, responsible for over 300 enzyme reactions in our body. And yes, that multivitamin, that aloe, makes it so much more bioavailable. And I think we should take them all too. So I love it. Thank you so much for sharing. So next we get to hear from a brand new mama, Jamie, who is a doctor of physical therapy. These products have helped her with energy, mood, and blood sugar balance. Even though she just had a baby 4 years ago, her favorite social distancing, 4 months ago, sorry, she had one many years ago too, but her favorite social distancing activity has still been hiking because she's pretty amazing. So Jamie, you have worked with many, many people who have been injured in your practice. So inflammation is a real concern. How does inflammation affect immunity?
Thank you, Brooke. So I want to first just illustrate a little bit about what inflammation is, and then talk a little bit about what I've seen as working in physical therapy for 10 years. And I think most people think of inflammation in terms of external signs, swelling, redness, bruising, and so forth. And inflammation is a normal part of our body's defense mechanism, and it's vital to our immune system response. So when our cells are under distress, they can release chemicals to alert the immune system, which then sends cells to, trap things like viruses or bacteria. And it's really our body's way of signaling our immune system to, come in and heal damaged tissue or, just defend itself and protect itself from, like I said, viruses and bacteria. And so inflammation is a normal part of our body's immune response. But when inflammation persists, or becomes chronic, it can really have a negative effect on our body's systems. It can affect all systems. And the goal is to really kind of keep that inflammation in check. And so if you think of a fire in your body, like a fire that keeps burning, that's like what inflammation is. And so when that chronic inflammation is there, we may not see or feel it until you see, damage, or you're getting that diagnosis. And so it's something that's really going on inside of our bodies, ongoing, and something we really want to try to get a hold of before it's too late. And so like a fire, that smoldering process, on your joints and your muscles and your tissues and your vascular system, and all the things. So Chronic inflammation is, different. It's when our immune system is on high alert all the time. So that process is just ongoing. And that can lower our immunity and over time attack, like I said, our tissues and our organs. And we do know that certain lifestyle factors like stress and foods that we eat, the standard American diet, refined foods and, certain types of sugars, processed foods, lack of movement, lack of exercise, all those things can play a role with that chronic inflammation. And, in my, 10 years of practice, I would see the chronic inflammation manifest through delayed healing, like post-operatively, a lot of times in chronic pain. We would do all the things. I think physical therapy is has many great tools to help with, dealing with chronic pain and restoring, movement and all these things. But I would see this block, with some patients. And I really believe that inflammation was a big part of that lack of, healing. And so we know that, in our country, obesity is, on the rise. And I know Rachel will talk a lot about, hormones and things. There's a big overlap between, gut health, inflammation, and hormonal balance. So I'm trying to stick to just inflammation. But when we are overweight, if we have more fat in our abdomen or visceral fat which surrounds our organs, our immune system is responding by pumping out more white blood cells. And the longer you stay overweight, the longer you stay in inflammation, right? So inflammation can travel to our whole body, and that's where we can have that effect on our tissues and our organs and, all the things in our nervous system.
So we don't want chronic inflammation because it harms our immune system. So that being said, what health advantages have you seen for people who are on Plexus versus people who aren't?
So see, things to myself, better mood, less anxiety, changes in appetite, positive changes in appetite, less cravings, healthy weight balance, more energy all day, better skin, better hair, nails, digestion, so many things. People, just saying I'm a better mom, and I feel that way too. I'm just feel much more confident in my own skin, and I just feel better. Feels great to feel better.
I love that. Can you repeat the 3 or 4 you said at the beginning? I think it glitched a little. I want everyone to hear this.
Okay, sure. Deeper and more restful sleep, mental clarity and focus, better mood, less anxiety. And I've experienced all these things, positive changes in, wanting healthier foods, less cravings, more energy.
I love it. Thank you so much. So all of that being said, what are your favorite Plexus products for reducing inflammation and strengthening immunity simultaneously?
So I would have to agree with others here and all of them. The triplex is a really great combo to start with for all the reasons that were discussed previously. And just to add on to some of those, I really love, X Factor was mentioned as well. I love the ease. I feel like ease. I've heard this called, I think Rachel, maybe it was you that called it this in the past, but an unsung hero. I don't know. But it is, I actually have the bottle right here. This is something that I take every day, and I don't have any aches and pains anymore. So it not only helps with, soothing, discomfort, but it really helps with inflammation. It has some natural anti-inflammatory, some, turmeric, bromelain, serrapeptase, green lipped mussel. And I think the combination of these ingredients can be really powerful in helping to combat inflammation. I do love the Omega X as well. Omegas, I think, in addition to heart and cardiac health, I think there's some great benefit to being on an Omega as well. And of course, like you said, X Factor, just those minerals, all the bioavailable ingredients, the aloe, the antioxidants could be a really powerful immunity booster. And then the microbiome blend in there too. So I really like all of those in addition to the E's and Mega X.
I love that. Thank you for pointing out that ease is great for not only healing if you have that pain, but even just preventing that future inflammation and helping with all of that. Thank you so much for sharing all of that with us. Enjoy your baby. And last but not least, we are going to hear from Rachel. She is our resident dubbed hormone expert. These products have helped her come off of multiple prescriptions and straight up gave her life back. Her energy returned, fatigue vanished, and her mood improved. It's helped her deal with stress better, which in turn we know lowers cortisol and balances hormones. Her favorite stay-at-home activity through all of this has been starting and watching A Little House on the Prairie. Gotta love that. So Rachel, what role do hormones play in our immune health?
So kind of hormone can be a real overarching term. I want to narrow it down to two specific ones, because really if either one of these is being affected, the other one is being affected as well. And all of your other hormones are too, because our hormones actually work in what's called a cascade. So there two things I'm going to tell you about, two hormones that I want you to hang on to and remember, because your body literally cannot survive without either one of these. Your body cannot survive without cortisol, which is a stress hormone produced by the adrenals, and it cannot survive without insulin, which is made by the pancreas. For most of us, stress is just a part of our daily life. We've got kids, we've got jobs, we go to school, we go to work, we've got spouses, life happens. And all of that is what we call acute stress, because it might last for a couple of hours while you're finishing up a project. It might even last a couple of days while you're trying to hit an end of the month goal or something like that. But when it shifts from acute into the chronic phase, it can and will take a toll on your immune system. This is the kind of stress that happens when events in your life surpass your ability to cope. It causes the body to start to produce excess amounts of cortisol. So, as mentioned by a couple of people already, cortisol in spurts actually has some immunity boosting things. You get a cut on your arm, you get redness around this. That's cortisol. You think about bug bites. We put hydrocortisone cream on it. That's a topical version of cortisol to lower the inflammation. But what happens when it's left unchecked, as Jamie mentioned, it becomes pro-inflammatory, and it literally puts your body into that state of fire that she mentioned. Additionally, when you are under stress for a long amount of time, it starts to reduce your body's lymphocytes. I know that's like a $50 word right there, but it basically means white blood cells. And what your body needs to fight off infections are white blood cells. So the lower the white blood cell count, the reduced immunity you have, and the more susceptible you are to viruses, whether it's the common cold, whether it is the flu, whether it is COVID-19. So stress absolutely plays a massive factor in how your body is able to deal with infections. It also can lead to depression and anxiety. Actually heard this statistic on the news today that from mid-February of 2020 to mid-February of March 2020, anxiety prescriptions went up by 34%. Anxiety or depression medications went up by, the prescription for them went up by 18%, and 3/4 of those prescriptions were given to people for the very first time, the first time they were ever being placed on this kind of medication. So what is the common denominator here? The common denominator is that we live in unprecedented stressful times. Stress has a direct effect on your gut microbiome. I know we all keep talking about the microbiome, but when your body is in stress, your sympathetic nervous system goes on overdrive, and it sweeps through your digestive tract and it wipes out the good bacteria. It takes it out, and all of a sudden you have this shift where we know we should have like this 80-20 balance of good bacteria to bad bacteria.
well, the good bacteria goes, especially if they put you on an antibiotic or something like that. And as Brooke mentioned in the intro, we know 70% of our immune system resides there.
That is crazy. Those statistics make me so sad. But almost every single one of these speakers, and myself included, mentioned that before Plexus, we had stress, we had anxiety, and that was lowering our white blood cell count, like you just said. So basically, we strengthened our immune system by also helping our anxiety and our mood, which is really, really cool. So how are these products affect hormone balance?
Okay, so this is probably my favorite question to answer, because our products that we have, and we've mentioned a couple of them already, and you're going to hear about them again, basically help with everything that I just discussed above. So remember, I mentioned those two hormones. I mentioned cortisol and I mentioned insulin that our body cannot live without. These two hormones share a very important common denominator, and that is blood sugar. So let's break this down step by step, how it should work when things are going according to plan, okay? So individual me gets introduced or faces a stressor. Then this really complex hormone cascade happens in your body that I'm not going to go into, but essentially your adrenals start to pump out cortisol. Cortisol prepares the body for a fight or flight response. When that happens, your body gets flooded with glucose or sugar, supplying an immediate energy resource to your large muscle groups. This cortisol also inhibits insulin production in order to prevent glucose from being stored, because it wants that glucose to be readily available. Okay, so if everything goes according to plan and as it should, the individual addresses and resolves the situation and the hormone level returns to normal. But what if that doesn't happen? What if we get into a chronic situation? You get blood sugar imbalance. So under stressful times, cortisol provides the body with glucose, and it does that by tapping into something called glyconeogenesis. It happens in the liver. Anyway, this energy, like I said, it helps you in fight or flight. It's the way that God designed us. Oh my gosh, there's a bear coming for me. I better run and get away from it. And then hopefully you get away from it and the stress goes down and the blood sugar goes back in balance. But when that doesn't happen, your body will consistently overproduce the glucose, and that leads to increased blood sugar levels. What happens when you have too much blood sugar floating around in your bloodstream? You gain weight. Another way that cortisol might be involved in weight gain, and I can't remember who mentioned visceral fat a minute ago. I think maybe it was Jamie or Lisa, but visceral fat is that hard belly fat that is stubborn and very difficult to get rid of. But the other bad thing about it is that, like I said before, it leads to insulin suppression, and this causes cells to be starved of energy. So this is why you feel weak. This is why you feel tired. This is why any bug that's going around, you catch it, because then your immune system suppression comes into play. We've already talked about the fact of what it does in terms of inflammation in the body, but chronic inflammation over time caused by lifestyle factors already mentioned, such as poor diet and stress, make your cortisol levels soar, but it also causes you to crave salty foods, sweet foods, simple carbohydrates. So if during these times you find yourself raiding the pantry and eating the processed foods, stop doing it. Your gut is trying to tell you that it needs something else, okay? It's literally like you're craving the very thing that is going to be worse for you. And then the other thing that gets impacted is our digestion. So in a cortisol flooded, stressed out body, when food gets consumed, people get bloated, they get indigestion, they get gassy, and they get constipated.
So you say you see a bear coming and we are like fight or flight. Oh my goodness, a bear's coming, but that's supposed to go away. But so many of us live in that constant fight or flight mode. It's making us tired. It's making us sick. It's making us raid the pantry during quarantine. So if all of that is true, we need to balance our hormones. What can we do? What is your favorite product or products to optimize immunity and balance those hormones?
Okay, so I've been with Plexus for 6 years now, and since I've been with Plexus from day one, we've preached three things. We've preached blood sugar, gut health, and inflammation. Blood sugar, gut health, and inflammation on repeat. And that is, and I hate to be the broken record here, but that's the exact things that Triplex was designed to help with. So you've got SLIM, either microbiome activating or hunger control, which both help to balance that blood sugar that we talked about. So the pancreas gets back to doing what it's supposed to do, cortisol starts to go down, and everybody starts to get back into what I call hormone harmony. Then you've got ProBio 5, which is, this incredibly powerful probiotic that uses soil-based bacterias, proteolytic enzymes, and that amazing antifungal. It's a 3-in-1 product that you can't walk into a store and buy anything like it, thankfully. And then you've got BioCleanse, that magnesium-rich formula that Lisa talked about, and how magnesium is so important. But BioCleanse essentially gets everything moving, for lack of a better term. People, you have to poop every day. If you're not pooping every day, there's a major problem. But it also helps to get rid of constipation, bloating, and all those uncomfortable digestive issues that I mentioned. I got to throw a shout in there for ease too, because I have always said it is the unsung hero of our product line. Because yes, it's great for aches and pains, but if you've got like people with skin issues, whether it's eczema or acne or psoriasis. I had psoriasis. That is an outward manifestation of internal inflammation. There isn't anybody that you know, unless they have a shellfish allergy, that really should not be on ease. Because if you're a science nerd and you want to geek out on it, Google the trademarked ingredient Eterol. That's the green-lipped mussel that was mentioned, and the studies that have been done on it, where it like way outperforms NSAIDs in terms of bringing down inflammation. We've already talked about our two incredible aloe-based vitamins. The aloe is what helps with absorption, but I want to mention too that one thing that's really fabulous about these vitamins is that they use methylated B12 and methylated folate, which we are learning more and more about is so important. And then the last one that I'm going to throw in there is Metaburn, because I did talk about that visceral fat and I talked about your cortisol levels. Metaburn contains an adaptogenic herb called rhodiola rosacea that has rhodiola that has been literally used for centuries, and it has been used in holistic medicine practices to lower cortisol levels and to boost immunity as well.
Thank you so much. I love listening to you talk. You always make the science feel so relatable, and I love that. And again, thank you all for coming so much tonight. You heard Brooke talk about how prescriptions are sometimes chemicals, and that makes our immune system lower again. So why not help naturally? You heard Lisa talk about how in her 20 years of nursing, she has seen more people stay out of the hospital when they take care of their immune system than just treating the symptom. Jamie talked about inflammation. We want to keep that down to increase our immune system. And Rachel just talked about hormones, how we can balance those and prevent that constant fight or flight. So many different products were mentioned tonight. Pink Drink. Many of you have seen or heard about that. The ProBio 5, the Vital Biome, BioCleanse, Mega X, Ease, X Factor, Metaburn. All of these products are absolutely incredible. And if you are looking to get started or you want to add some of them, talk to the person that added you here tonight, because our president and founder, he has a goal that everybody is on at least 3 products. And I'm on almost all of them, all the ones mentioned tonight, certainly. And I think all the other speakers would say the same. You cannot go wrong. The more that you take, the better that you'll feel. And we are not at all claiming that any of this is a cure or a miracle magic pill that you're going to take it and never get sick again. Not at all. But just like if I'm going to go out in the sun, I want to prevent by wearing sunscreen, or just like if my foot hurt because I had a rock in my shoe, I'm not going to take Advil. I'm going to get the rock out. That's what these products do. They heal past damage. They prevent future damage by getting to the root, balancing hormones and blood sugar, reducing inflammation, and getting to the core of your gut health. So we hope you'll get started with us tonight and feel your best. Thanks for watching.